It's a great pleasure to be here. I join David and the rest of the committee in thanking the presenters for an extraordinary job. And we have three great experts in the field this morning, talking about various kinds of systems issues. And I won't go through all of the extraordinary accomplishments in order to leave more time for speakers. Richard Spath is the F. Wendell Miller Senior Prevention Scientist and the Director of the Partnerships in Prevention Science at Iowa State University. As the Institute Director, Dr. Spath provides oversight for an interrelated set of projects addressing a range of research questions on prevention program engagement, program effectiveness, culturally competent programming, and dissemination of evidence-based programs through community university partnerships. These programs have received funding from numerous federal agencies. He's received a merit award from the National Institute of Drug Abuse for a large-scale study evaluating family and school-centered interventions. And one of his projects was one of the 10 projects selected by NIDA as one of the key ones in preventing drug abuse among children. Dr. Turji Ogden holds the position as Research Director at the Norwegian Center for Child Behavioral Development and is also professor at the Institute of Psychology, University of Oslo, Norway. He's specialized in intervention and implementation research. His interests include clinical trials and large-scale implementation of empirically supported interventions, targeting antisocial children and youth. Included are studies of moderators and mediators of effective interventions. He's presented numerous times, written numerous articles. He also is the project leader of an ongoing longitudinal study of the behavioral and social development of children, which is about 1,200 children followed from 6 months through fourth grade. Mary Jane Rotherham-Boris is professor of clinical psychology and director of the Center for HIV Identification, Prevention, and Treatment Services in the Division of Social and Community Psychiatry of the Neuropsychiatric Institute of the University of California, Los Angeles. She's spent 20 years developing, evaluating, and disseminating evidence-based interventions for children and families, and has worked extensively with adolescents, especially those at risk for substance abuse, HIV, homelessness, depression, suicide, and long-term unemployment. She's directed a number of hallmark studies. She's received more than 40 grants from the National Institutes of Mental Health and the National Institutes on Drug Abuse to design prevention programs for children and adolescents at high risk for HIV, mental health problems, suicide, and substance abuse. In 2001, Science identified her as number 2 of the top NIMH multi-grant recipients. She was the only woman in the top 10. So I guess we'll begin with Dr. Spath.